Hello and welcome, and thank you for joining me. My name is Stephen Perlin, as always, and I am here today at the UHS Sleep Center. No, I am not wearing new fashionable clothes, but you will find out what I am wearing in a little bit. Sleep is one of the most important things to people. I think you can talk to almost anybody and they'll tell you, oh, I didn't get enough sleep, or I want more sleep, or my sleep wasn't good enough. And that's one of the reasons that the UHS Sleep Center exists. We're here where we diagnose and treat patients who suffer from sleep problems and even daytime alertness. I'm here with nurse practitioner Leanne Stevens, and she's going to talk to us a little bit about what goes on here and what people can expect when they come in. Thanks for joining me, Leanne.
Well, thank you for having me, Steve. Here at the UHS Sleep Center, we do many different testings. We do sleep studies, we do home sleep studies, we do in-lab studies. We test for many different things like sleep apnea, narcolepsy, and try to figure out what we can do to help everybody get the best sleep possible and stay in the best health.
So people, I guess, probably are a little confused when it comes to hearing the word sleep disorder. Somebody might think, oh, I wake up in the night, I twist and turn in the night, I must have a sleep disorder. But that's not exactly what we're looking at here. It's a little bit deeper than that. Can you talk to me a little bit about what sleep disorders are and like what we are treating and the type of disorders there that exist?
Sure, Steve. Well, tossing and turning is actually more of a symptom more than a disorder, and it can be related to many different things. So many of the symptoms that people have is snoring, excessive daytime sleepiness, nighttime urination. People that get up multiple times in the night to urinate may have a sleep disorder, and that might be the cause of it. Waking up choking or trouble catching their breath, that also can be related to a sleep disorder. Morning headaches, people wake up and have a headache every morning and they can figure out why. That can be related to a sleep disorder. Insomnia, people think, well, I'm not sleeping, it must be, it's not always related to just not being able to sleep. It can be related to an actual disorder. When they're not dreaming, when they're tired during the day, waking up with chest pains, heart palpitations. In kids, it can be very common to have a sleep disorder, and it's manifested by children that have ADD, ADHD, they have mood disorders, or poor performance in school or in sports, and it's hereditary as well. The most common sleep disorder that we diagnose and treat here is sleep apnea. And that's when what happens is the person will stop breathing in their sleep and they're not going to get enough of that good restful sleep, which keeps them healthy. And this makes them wake up numerous times within an hour. Anytime somebody's waking up 5 or more times per hour, it's considered apnea. And if we treat this, a lot of times they start feeling better. The problem is many people wake up, they don't realize they wake up. And that's what we actually find on a study is how many times they wake up per hour, and if this could be the cause of it. And treating it a lot of times can really impact somebody's way of living, help them feel better, as well as help all their health issues.
And well, it's one of the things we do, and one of the places we mentioned we're at the UHS Sleep Center right now, and we're not in a hotel room, but it might look like one. This is where we do some of those testings to find out more about sleep apnea and if you're waking up and stuff like that. Mm-hmm. Tell me a little bit about these cool items I'm wearing and where we are and what goes on here.
Oh, sure. Well, first of all, we do home sleep studies. There's 2 different kinds. This one is actually called a watch pat study, and this is basically how it's put on. We would have you come in and get it. You wear the watch. You put this on your finger, and there's another probe that you would run up your pajamas, and that you would put right here on your chest. You would literally push the button at nighttime at home. You go to sleep, you get up the next day, you take it off, you bring it back.
Now what happens if you have this, like some people twist and turn, as I mentioned before, will it fall off or it sticks on pretty good and you get a good idea?
It's pretty sticky, and also we give tape to help you put it on, and this has a piece that helps keep it on.
Oh, cool. And unfortunately, it looks like it does only come in blue, so you can't match all your different pajamas, but that's one of the things you got to do when you're trying to get healthy. And then I have something even more on my chest here. What's going on here?
This is another type of a home sleep device called an Alice One Night. How this works is you wear this around your chest as a strap. It's got one probe that goes on your finger that you would tape on that night. And this actually looks like oxygen tubing, but it would go into your nose just like oxygen tubing would. And you would get that nice and comfortable. And just like the other one, you would wear this at nighttime. And we like to have you get at least 6 hours of sleep and then take it off the next day. Actually, it just pops off like this. Yep. Take everything off and bring it right back to us. And we will actually download it on our computer and read the study and see what it shows.
And you said that's something that's also done at home? Or?
Yes, this is another type of test that's done at home. Now, not everyone has to have home sleep studies. Some people, if they have some medical issues, come and have an in-lab study. Children have to have an in-lab study. And that's done in a room that looks like this. It looks just like a bedroom, just like a hotel room. Now that one is a little more involved, in which we do put some electrodes on you, more so than just the few that we put on. We put some on your head to check for brain monitoring, and some by your eyes and your chin, and a heart monitor. Just those little stickies like you see you'd see in the hospital. We put some on your legs. We put a pulse ox it's called a pulse ox on your finger. We put a couple straps on your chest, and actually, I'm going to grab this. All those little wires go into this box, and this is what you would actually wear this for about an hour after they hook you up. You'd wear this for about an hour, and then they'll put you into bed about 10 o'clock at night. You would go into a bed just like this, and you actually sleep here for the night.
Oh, wow. Yeah, I can attest that it is a very comfortable bed. I'm sitting on it here now. Now, most scenarios, do you usually start with a home test kit, and then if things progress or you think there's more testing to be done, then you bring them in, or it depends on the situation?
Depends on the situation. Most is insurance driven about what the insurance company is going to cover. People who do have a lot of certain chronic medical issues really do need to have an in-lab test.
Okay. That makes sense. And something you mentioned to me earlier that I want to make sure we get for the people is about sleep apnea. One of the things most people, I think is that sleep apnea is something that only overweight people get, but it's really more than that, correct?
Oh, absolutely. There is a common misconception. Everybody that has sleep apnea snores. Not everybody that snores that has sleep apnea. Not everybody that has sleep apnea snores. Obesity, people think that everybody that has sleep apnea is overweight. That's totally not true. It is actually more common as people get older, and for women it's more common actually after menopause, no matter what their size. I have little old ladies that are actually, they weigh less than their age and have terrible sleep apnea.
Oh, well, see, so it's for everybody, unfortunately, but it's good to know for people that, kind of assume that if you have it, you must be overweight in some way or some, kind. Do you have some tips for our viewers on just maybe for going to sleep or sleep tips in general?
Sleep tips